Warm greetings to our participants from around the world. It is an honor to have you with us at the Global Changemaker 20 Summit. And as we are almost culminating day two of the summit, it is amazing to see a range of themes already being discussed on the platform. And today I'm delighted to introduce two very dynamic and amazing speakers with whom I have been fortunate to have built a very strong bond uh, over the time. And the theme in itself is something which has grown close to my heart over the time. So, before I introduce our speakers for the day, I would like to share a brief about the theme of the conversation for the hour. So, the theme you can see is Voices of Care Leavers. Now, I would not delve deep into it, but I would just say that the session is going to highlight on some of the often overlooked hurdles and factors on the safe economic inclusion of care experienced individuals. Now, who are care experienced individuals? I think we would be hearing more about it from our speakers today. And now, introducing our lovely speakers for the day, we have Lourdes Cavifela from Namibia. She is an advocate for care leavers with vast experience hosting global monthly cafe sessions for care leavers across the globe. And she's currently working with a humanitarian organization supporting various youth projects. She'll be talking more about it through the session. We are very happy to have you on board, Lourdes, today. And we also have someone from Sri Lanka who is very close to me, who's Nimali Sriyakanthi Kumari. She is the project manager, Sarvodaya Shramadana Society, and coordinator and founder member of Generation Never Give Up Network, which is Asia's first, I think, biggest care leavers network that's being formed. So I think this short description is enough to sort of kickstart the session. And now to take up the conversation and hear more from our amazing speakers, I would like both Lourdes and Nimali to take the stage. Over to you both.
Thank you, Judith. Thank you for that introduction. And like Judith has rightly put it, I'm Lourdes. And my passion is empowering young people to overcome challenges for a better future. And currently, I'm working as a project officer under a humanitarian organization, and it addresses on issues surrounding HIV and AIDS. And actually, as we speak, we are running a project called The Young and Empowered, which is to navigate through the complexities of HIV and AIDS. It covers all the different areas of young people in terms of their health and their empowerment in general. And I'm also an advocate for care leavers, like Judith has rightly put it. And yeah, I'm honored to be here once again. I would like to give this opportunity to Nimo to also introduce herself, and then we can continue with our discussion.
Thank you, Lourdes, and thank you, Judith,
Nimo, over
and
to
also
you.
Sumina for the great opportunity for giving us. So myself, I am Nimmu, but you can see my name as a Nimali Sriyakanthi Kumari, which is my real name, but I'm so many people call me as a Nimmu. So I am from Sri Lanka. Currently, I am working as a project manager and project coordinator for two projects, which is working for the benefit of children, and I'm doing kind of a community awareness program for the prevent of children going to the institution care. So also, I am the pioneer member of Generation Never Give Up Network, as Judith mentioned, that the Asian First Care Leavers Network. So we have more than 500 care leavers members there. So I'm working with them, and also I'm currently studying in criminal psychology and offender counseling from Sri Lankan University. In the same time, we are planning to do kind of a transition home for the care leavers in Sri Lanka. So running kind of a project, and you can, after our discussion, you may know about ourselves, what we actually achieved in our life and what obstacle we have faced. Everything you may get to know during our session. So shall we begin the session, Lourdes?
Yes, today here at the Global Summit for Economic Inclusion, for Financial Inclusion, I'm here to advocate on behalf of caregivers. And like Judith has put it, we will look into issues that are often overlooked when caregivers transition into adulthood. And we are representing the voices of caregivers around the world. Caregivers covers quite a lot of individuals around the world, and they have personal experiences, and those experiences usually are around care systems, and such as foster care, residential care, and perhaps Nemo can add later on. And they are called caregivers because they leave care eventually at some point in time in their adulthood. And yeah, our commitment actually as advocates for caregivers together with Nemo is to make sure that we ensure a positive change for these young people, to access necessary tools for them to be able to navigate through financial issues. So Nemo, I would like you to just give a little information on your experience in terms of finances when you were in care. How much were you aware of financial issues? Could you
Thank
just
you,
take us
Lourdes.
through that?
So I felt so when I heard the word of financial, I feel like laughing because to be honest, now I am even 34 years. I can't manage myself for even saving the money. So I think the financial literacy, which means lot to caregivers, because maybe there are so many people that who don't understand about the word of caregiver. So I just want to little bit add for that also. So caregiver means that the example is here, Lourdes and myself, and there are a lot of caregivers. I think here they are also here. So caregivers mean the children, the child who live within the childcare institution, but after they reach out to 18 years, they leave the childcare institution. They must leave the childcare institution. Those who leave the childcare institutions, those who leave the alternative care system, they are the one who is caregiver. So going back to the Lourdes question, actually, Lourdes, when I was earning in my life in the first time, I was busy with buying, purchasing, and only the things that what I like to eat. So I have never thought that I just want to keep saving some kind of a money for my future. So I think during when we are staying in the childcare institutions, there should be really for giving us a kind of a training at least to save money to because you know that especially for the economic crisis what we are facing in Sri Lanka currently, uh, it's lot to us now because you know that even when it was in the highest time on the protest in Sri Lanka, uh, the bread one bread is pieces what kind of for 250 to near to 350. So even our salary was not enough to take kind of purchase the food also. So if we really knew that at least we should have kind of a saving money, maybe definitely we may able to face all this economic crisis situation also. So I think somehow the educated or the better those who have the better life of caregivers, because some caregivers have living very high level life. So other than that, those who don't have really voice to raise that whatever they are facing in their life, I think every caregivers must train for the financial side, at least save something for their higher education, for whatever if they have getting kind of a if they need kind of a medical support, they are actually they should know that there is no one to support them. So I think that they should be trained within the center. So this is from my end, Lourdes. I think you also can add something, no, Lourdes?
Yes, yes, yes. I also remember that I didn't have access to resources while I was in care that could teach me on budgeting, saving, and managing debt. And now, as an adult, you know, you have to make financial decisions. And well, we just have to learn. I'm grateful that I've had a lot of platforms where I've been able to learn more about finances. Now, let me just take you through the listeners. Please allow me to just take you through the general challenges that caregivers face. We just finished discussing some of our personal challenges that we faced in regards to finances. Now, when we talk about at global levels, it is true that caregivers do lack financial literacy. Many of them did not have the opportunity to learn essential financial skills during their time in care. They also lacked knowledge on what I've just mentioned: budgeting, saving, managing debt, and understanding the financial systems, you know, so that they can be able to make financial decisions. Another one is limited support of networks. Caregivers, they lack familiar and social supports that they need when they transition into care. Usually they find themselves stuck because they lose the relationships that they made in care. It's not really continued in terms of the staff. And then some, when they get into society, it becomes also difficult because they have to establish new relationships, and that may take time. And also the fact that this impacts the ability for them to find stable employment, housing, and many other financial resources that they need in order to survive as an adult in society. Another challenge is education disruption. Usually, caregivers sometimes leave care without having completed their education. And like vocational skills, some of them do not have the opportunity of a qualification from the university or from vocational. So then that also affects them in terms of getting employment. And that also leads to the ability of them to acquire assets such as houses and you know, other assets that we as adults sometimes need. And also they have a lot of emotional and psychosocial issues due to the traumas that they face before and after care. Those are just general challenges that I finished mentioning in regards to caregivers. Nimo, would you now perhaps give us a scenario in Sri Lankan in Generation Never Give Up Network in terms of what you have
Yes,
observed
Lourdes.
from
Other
caregivers
than whatever you
facing
are mentioned,
challenges
that everything is yeah,
to
everything is
finance?
same for us. Apart from that, the biggest challenge facing by caregivers in Sri Lanka is the document-based challenge, especially which means the birth certificate issue. Because most of the caregivers having kind of a probable age certificate in Sri Lanka, not the national birth certificate. So we, as a team, as a Generation Never Give Up network, also we have been raised this question among the ministries, among the policymakers, to aware about these challenges, because you know that some caregivers, they want to at least create kind of a passport, but when they enter to the immigration department, some officers, they don't know about, and they don't have an idea about the probable certificate. So because of this case, a lot of caregivers facing difficulties, and they are sometimes they are neglecting from the society, because, and even from the schools, because if either they are really challenge, like they are really talented on the sports level, they can't participate for the Highland sports because they can't identify their ages, because there is nothing, there is no any documents, but the probability certificate is also making trouble to them. So this is one kind of a challenge for caregivers. And even the problem of housing, I think housing is the main challenge for the caregivers, because when they reach out to the like example, if a family, if a child from family, they never used to say that, now you are 18 years old, then you can go out. They will never say, if when a child is like in a home. But when the child care institution child is reach out to 18, definitely they know that they should leave the child care institution. So when they reach out to even the 15 years, they realize that we have to go out. So the point that the time that they feel like they have to go out means mentally they are going to be down. So I think with the age of 15 or 14, they are really getting mentally upset. So the biggest challenge is that pre-prepare in the caregivers, the youth before they enter the society is must be there. So which I think the biggest challenge for the caregivers. Without preparing, they go out to the childcare out from the childcare institutions also.
Thank you for sharing on those perspectives, Nimo. I just want to take you back based on the challenges that I've mentioned. You know, usually caregivers find it very difficult, like I said, to find support systems. They have to navigate around society to make new relationships. And unlike many individuals who already have families, they have mentors who they can turn for advice, for caregivers, they have to figure out things on their own. And this also affects them in all areas in terms of finding jobs, in terms of finding the right advice in order to make proper decisions. And I don't know, Nimba, perhaps you could also just share with us how was your experience of not having support systems, or maybe you had support systems when you left care. How did you
Yeah,
navigate
yes,
through
dear.
that
Lourdes, actually,
to attain
from
your
my end,
economic
like
stability,
as
maybe?
I mentioned that I can manage myself by lucky chance in my life. So I got support from many people. But to be honest, that there are kind of careless, like children who were with me. Even some of them, they can't read out at least one word in the book. Even they are not going to speak out. So uh, there should be kind of a support for them before they leave, because at least they should have prepared for kind of a to study vocational training, at least vocational training, because every child is not ready for the formal education. There is something unique in the child, even one child. So they should understand what's really unique for the each child, and then they should have kind of preparing a care plan for the children. So this planning of the creating of care plan will be definitely help for the children. So myself, for me, that I got support after, even after care. But I know that there are so many caregivers in even Sri Lanka, they are not allowed to go back to their places where they were cared. So, and even, like, per day, I think I'm getting 2 to 3 calls from the caregivers, those who were with me, asking that, can I keep my child in the same institution where I was care. So it's kind of a circle. So really, it's we have to aware for the children who are leaving the childcare institutions, how to live your life when you go for the outside, while you are choosing kind of a person to your life, whether your husband or whether your boyfriend or someone, whether when you are going to choose someone, the quality of that one, and the care, love and care, how they are feeling, is everything should be trained. Even a single thing what child should learn should be like trained inside within the center. And like before they leave the childcare institutions, I think definitely they should be prepared for facing each and everything. The very best example I will give you, during the COVID period, two of our caregiver was really committed suicide because they were not ready to accept the neglected from their family. That when there was a curfew in the Colombo district, police was asked to leave the boarding places for some people. So two caregivers went back to their home. They were rejected the child. So when 22 years old boy, he was committed suicide because he was not having any place to go. And one time also the reported case was the caregiver was from same my NGO, same my childcare institution. She was get positive, COVID positive, and she was living in the boarding place alone. But the owner of boarding place was asking that why you are not going for your home. You should go home because we can't be here with the positive COVID positive one. So she was calling me and crying that where I will go. So this is kind of thing that if she was getting kind of hopeless and loneliness and that getting back to the trauma, definitely she will also kind to become a suicide. But by chance I was able to help her. So I think even the basic life skill they should teach to the caregivers.
Yeah, I definitely agree on that, Nemo. I think it's really a big need for a comprehensive transitioning plan to be made for each caregiver, where they can be able to receive financial education, job training, and support services that can help them understand and also manage money very well as they go out into society. And mentorship programs, I think, are really crucial for caregivers. They are really, really. I don't know if you have any program around in your network, Nemo. If you have any program in regards to mentorship, is there any organization supporting your network in terms of financial mentorship to the 500 caregivers that are part of your network?
Yes, Lourdes. Like for our network, there are 500 caregivers, 500 plus caregivers. So for us, we have kind of a resource center. So we are supporting the caregivers for finding the jobs and for a scholarship for the higher education. This everything we are getting support by individual donors from Sri Lanka. So even for that, some caregivers who really want to continue their higher study, so many people are supportive for them. So this is really very good coming up the people to help caregivers. And also talking about the mentorship, we ourselves as a Generation Never Network executive team, we have 7 executive members, president, secretary, and everyone. We used to visit the childcare institution around Sri Lanka to aware the children how they should come out and what is happening around the city or around the world. And we are learning teaching to them that how we have faced the obstacle when we are after we leave the care. So this will make definitely understand to them that because we are live experience for them. We used to tell them currently we have 379 childcare institution in Sri Lanka, more than 10,000 children there. So we are targeting the group of 12 years to 18 years, and we are doing the awareness program for them. So I think we act as a mentors to them. We act as a role model to them. So we are sharing our stories, how we face obstacle in the outside, how we survive our side alone. So everything we are explaining to them, and we also tell them that you are not alone. That we are here when you come out. So they will not go in any wrong path. Definitely, they will come to us. So we thought that from our side, our end, we have to at least start the system here. So that's why Generation Never Give Up Network also plan into that.
I'm really glad to hear all the efforts that you are making in providing financial support and skills and knowledge to the caregivers. I think it's really important to extend those services to them beyond the age of 18, since, like I mentioned, they sometimes find themselves stuck and becomes difficult for them to face the world independently. But when they have somewhere where they can bounce back through the network that you have just mentioned, I think that's really, really good. I'm glad that
Yes, another one.
your network is doing a great job. And
Yeah, no, I just wanted to add something like,
yes,
see
please go
now,
ahead.
myself and yourself, we are in the international forum. So this is not the first time that we were here, but there are so many international forum that where we get connected, and even our polishing our languages. Even there is a barrier of languages. We met each other. We are online. We talk to each other, and we are facing international events such like this and change maker like this. So it's really honor to us. Even the respect that we are getting, even the love we are getting each from each other, this is really what we expect from the society. And we know that the other caregivers, each and everyone is expecting these things. So I think uh, this is also a great opportunity, isn't it, Lourdes?
Yeah, very, 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 very much. And just wanted to add that it's really important for us and caregivers, I think, just in general, to seek help and resources. They need to reach out to organizations and mentors that can provide them other necessary skills which they feel they do not have. I'm sure there are a lot of organizations out there who are willing to help. They are willing to see caregivers strive. I think we can perhaps just give a few strategies or few ideas that could be implemented for that could be action plans perhaps that we could think for caregivers, Nemo, in general, something that we could maybe share over the monthly cafe session or in your network, in your caregivers network, as action plan based on these discussions that you're
Yes,
having
I was also
today. Do you
thinking
have
on that,
anything in
like,
mind?
Lourdes, we can really, because I have shared this link to the our Calivers network. I hope that they also join here. So, giving the opportunity for the Calivers make they comfortable to face in the everything. So, I think kind of this event, kind of the monthly online cafe for the Calivers. I think this make interact with not only Sri Lankan Calivers or not only Nambia Calivers, not only Indian calivers, there are so many calivers from the so many countries. So I think having connection of that, we even we feel like whenever we need support, uh, it's not kind of a support from a kind of money or whatever things, but the support and that feeling that when there is someone, even for the chat for the WhatsApp, when I'm feeling so sad, I can chat to Lourdes, I can chat to even Judy, Sumina, whatever, wherever there you are, that I can just show my views and I can just ask guidance from you. So this connection, this relationship is made by this kind of platform. So I think all the caregivers should join this kind of platform also. So we can just do the this awareness for the caregivers. Please join and this kind of events also.
Yeah. Thank you for that, Nemo. I also think it's important for us as advocates for caregivers to promote comprehensive transitioning plan from the care system. They need to know that this is a challenge. Oh, I'm sure they are already aware by now through our through the different I think we had 2 caregivers convention where we brought it very clear to care institutions that these are our struggles, and they need to keep it into account that before a caregiver is out of the care system, they need to make sure that there is a comprehensive transitioning plan in place. Perhaps you could just take us through, because you participated in the first caregivers convention, Nimo. Could you just give us key items that
Yes,
came out of
Lourdes.
those
So I was there in
discussions?
the convention for California convention. So we had shared the declaration with the people that with kind of a 11 key finding from the Calivers. It's included kind of educational support, psychological support, housing issues. What are the challenges, especially mainly we have focused there. So for that event, when I'm talking about Sri Lanka, the House of Ministry, one like presenter, he was there, and after we having the discussion on the housing issues, because for Sri Lankan Calivers we had this part to present there. So after we have present there, they have decided that they will help us. So the better things that we got chance to meet the ministry and the president of this housing. So they have taken all the name list from the caregivers, those who need support, or those who need the land, those who need the house, everyone. But unfortunately, during the because of the political issues, it has been changed. First, because of that event, I think so many people knew that there is a network called Generation Never Give Up, and also there are caregivers in Sri Lanka, that there should be kind of a system for them, at least a tracking system for the Cali, because there is no evidence, there is no record that how many Calivers leave the child care institution even per month. So even these kind of things, after the convention, uh, the policymakers has taken the serious way, and currently the National Probation Department and the probation officers and the probation department, immigration department, and also the registration register department, everyone is supporting for us. Whatever the challenges we are facing, they are in the supportive way. So I think the very best outcome was that for us.
Is this the?
Yeah, so I'll maybe read
Can
out
you allow any
it from you
comment
so
or
that you can
question?
maybe speak more on it. You can share your thoughts on it. So I just wanted to put up this question on. So we often hear how we want to form a caregivers network where such issues are being taken up. We hear from each other. We work together to understand a safe transitioning process, or process after that, after once you leave the transition care system. What sort of policies and what could be done to make the situations little better? How can we support the care experienced youth? But often we also hear that it gets somewhat difficult to map the care experienced youth and bring them together in a network. It's a challenge sometimes, because when we have connected on a global platform, this is something that we have heard a lot, that maybe we want to help them out, sort of support them out, but it's often gets very difficult to map out the care experienced youth. Some, they don't want to be recognized as care experienced youth, or maybe the so the question sums up around how difficult it is to sort of bring everyone under the umbrella, where you can sort of polish them up, make guide them, support them, make them understand of a safe economic, financial literacy, or making them understand more about economic inclusion, what sort of pathway should be taken up. So, as a first step, what do you think? How difficult it is to even reach out to them and sort of orient them towards this thing, as a young adult moving out of the transition system? How difficult it is for them to comprehend all these things?
Perhaps you could go first, Demo. I missed some parts of
Yes.
Judith's
Yeah,
comment or
so from my
question.
end, like I
You
think
could go first, and then I'll take it on.
it's really important that policymakers are thinking about the age of the caregivers, because they think that 18 is really risk age. So is it really need that after 18 they should leave the childcare institution? Because at least I think that they should get support till 25 years, at least 25 years they should get the support. So there should be kind of a system for that. And even I think that the tracking system what you have mentioned is there is no evidence, there is no something like the data statistic on the caregivers. There should be tracking system, there should be some kind of officer at least in the probation department or wherever that in the government department, they can at least track the child that where actually they are living currently. So they don't want to go back to their families and everything, but they should have kind of a plan to the child that thinking about that where now he is doing, what he is doing now, is he safe or not? That there's information that should be come to them. At least they reach out to 25 years old. And also, I think do kind of a awareness on the officers, the government officers and the matrons, the house mothers of the child care institution. That should be also done the proper way, and the quality services should be there. So monitoring of the quality services of the center will be definitely help to the come out in the good child, or like a good taking a better child for outside out to the child from child care institutions. And also I think the very if the policy makers can like think, after I have heard kind of a story that when kind of my one of friend, when she was 11 years old, she got in the appear in the court, and after she get married, and only that the court decision, final decision is going to be happen. She was crying that I'm married now, my husband don't know that there was kind of a court case, how can I go there? So the judicially, I think judicially, during the when they asking the question from like when there is a court case for the children, I think before they leave the child care institution, it should be sorted out. Otherwise, their lives is going to be definitely the uh, facing the problem so many. So I think this kind of thing should be changed within the society. And also talking about the difficulty of taking care leavers into the network, even same thing we have faced out. I think the reason is behind that is the attitude of the care leavers and attitude of the people and the thinking matters of the society. Currently, now myself, Lourdes, we can say proudly that we are caregivers. We gone through this way, but so many caregivers don't have that voice. I think the people's attitude and people's matter how they are seeing the caregiver should be changed. It should be positive. That I think it will be helpful.
Yes, I can also resonate with that, Nimo. I have personally have been trying to also work around establishing a care leavers network here in Namibia. And because of the lack of tracking system, it has been a big challenge for me to actually get it on board, get it done, and move forward with it. So the tracking system is a need. And I think from the caregivers side, it's also very important not just see caregivers as children who eventually will have to leave care and have nothing to do with them. Because many a times they are left out as if there was never a relationship built, and the caregivers get lost out in society. I think it's really important for the relationship to be established. And if there could be a reference to the care to the caregivers networks that are to be established, it would be great, because they are the ones, they are the first, they are the people who are in charge of these caregivers before they leave care. So I think that's really important. I think we have a question.
Yeah.
This one is to you, Nimo. You mentioned that you mentioned that instead of caregivers leaving at the age of 18, perhaps 25 would be an appropriate age.
Absolutely
Sumena,
correct.
I hope I pronounced your name correctly. She wants to know what makes you think
Yes, I
that
Yes.
have just
25
Neem,
is an appropriate
just
age.
adding a few more lines to the question. So, like you just mentioned that you're 34 in the beginning of the session. So, and you also mentioned that you're still struggling to manage your finances and everything. So, what makes you think that 25 is an appropriate age? As in, we've worked with so many care experienced youth and children in the care system, and I am not sure how do we come down to this age? What makes you think? Just a clarity, just to understand what makes you think the same, please.
Yeah, actually, I have commented to there that according to our caregivers that who I am dealing with, so like I'm not telling that the children should be until 25 years they should be in the institution. I'm not telling that. I'm telling that till 18 to 25 at least we should monitor them the age of 25 because according to my things that my side our caregivers most of the caregivers continue their studies up to 25 years 24 years and they are going for the job opportunities. So I think when they have getting a job they are stable, but the thing is that they should be prepared pre-prepared for the even everything for the financial management or let really say that I am 34 years but I can't still manage. It means we can't define that appropriate age, but I think at least till 25 there should be support, continuous support that will be definitely help for them at least because I didn't get that support. I didn't get that financial management, how to do and everything. So that's why the till 34 years I can't manage that. I think when they are 18 to 25, if we can monitor them in that period, we can definitely help them to get an idea on the financial management and everything.
Do you have anything on this age gap you have mentioned? You feel like 25 is an appropriate age, or is it like a benchmark age just to ensure smooth transitioning? Do you have any comment to make, or maybe we can move forward as well?
It's quite difficult to actually put an age on it, to put an age on when caregivers are ready, are to be ready to deal with their finances, or even when they are to leave care. Even though we understand that a care system, one cannot stay there forever, but just in a family setup, there are times when a child or an adult still remains not a child, but an adult still remains with their parents for as long as they are 37 years, as long as they are whichever age they are comfortable to leave home or when they are ready to leave home. But with caregivers, we find ourselves really pushed to a corner where we are forced to live into society, to move into society, regardless whether we feel we are prepared or not. And that can lead to anxiety, it can lead to depression. I think it's really, really a difficult journey for caregivers. They have to navigate through a lot of issues around their journey in life. Nevertheless, I should say that I'm a proud care experience adult, and I've also seen quite a number of them who are very resilient. Despite the challenges they've gone through, they've pushed through and they've made something out of their lives. Nimo is also an example. She's here with us. Yeah, and along our journey, sometimes we find people who are supportive, and life moves on. Yeah, just to perhaps add more on strategies that could really help caregivers when they transition. I think some of them were already mentioned as we proceeded with our conversations. But just to add, once again, financial assistance, I think it's very, very important. Financial support in terms of forms of grants, scholarships, and low interest loans that can help them to cover their educational expenses for those who left care without completing their education. And that could also help them to cover other essential needs. I don't know, perhaps Nimo, you could just add on this one. Have you had caregivers who have received grants, scholarships, or low interest loans that has supported their educational journey or their other essential needs?
So thank you so much for taking everyone of us through a journey of care experienced youth, right from the transition home to the difficulties of mapping out, but the need of doing it, to understanding where are the barriers and challenges, to also navigating us and helping us understand what are the strategies also giving the best examples of, one of the biggest networks, Generation Never Give Up. Also, Lourdes trying hard to form, a Namibian caregivers network. And I'm sure that you'll be able to map out and form a network there, but you are already part of such a global platform, global caregivers community. Together, I think you both have been passionately advocating for the care experienced youth, and it is always an honor. So, thank you so much for taking out your precious time and joining us. And can't wait to hear you both on more such global platforms, actually. And thank you so much to all the joinees who have joined us. And we will be definitely taking up questions to Lourdes and Nimmu if there is any. But thank you so much.